Broadcast is now starting. All attendees are in listen-only mode.
Good morning. Before we get started, I want to let you know this session is being recorded. By participating in this session, you are consenting to the recording, retention, and use of this session. During this session, your microphones are muted, so if you have a question, we encourage you to put them in the chat. We will post the PowerPoint, a recording of this session, along with your questions and the department's answers on the DHS website. Good morning and welcome. The Department of Human Services is pleased to offer this training session for dentists and PhD-HPs wishing to enroll in the Pennsylvania Medical Assistance Medicaid program. After completing this enrollment step, you will be able to credential with the MCOs that you choose to participate with. We have several staff assisting with this training today. My name is Sandy Migliarese, and I am the Division Director for Provider Enrollment. Our Bureau Director, Michelle Robeson, will be monitoring the chat and will help us in getting some answers to you throughout this training. Our trainers for today's session are Benita Bishop, Provider Enrollment Supervisor, and from our vendor, Gainwell Technologies, Provider Services Manager, Lana Elias. And with that, I will hand it over to Lana.
Thank you, Sandy. Good morning, everyone. Today we will be going through the training for enrolling new dentists and PhD-HP providers. Our topics for today are going to be, first, we're going to review the Affordable Care Act. We'll also be going through how to access the enrollment application. Benita will review the enrollment application completion. We'll also review how to resume an application that's been previously started or an application that has been returned to the provider for rework from DHS staff. We'll review how to check the application status, and then also discuss change requests, which are extremely important, and then finish up with resources and questions at the conclusion. In accordance with the federal Medicaid regulations, all providers who wish to render, order, prescribe, or refer do need to be enrolled with the Pennsylvania Medical Assistance Program if you're going to be rendering services to eligible MA recipients. Additionally, if you're a dentist or a PhD-HP provider and you wish to participate in the MCO network as a provider, you need to be enrolled in the MA program first in order for you to be able to credential with the MCO plans. Additionally, the ACA requires that all providers who are enrolled need to revalidate their enrollment every 5 years. And so just as a note, we just want to address that the training today doesn't address any MCO credentialing or contracting questions with regards to the MCO, so you would need to address those to the plans directly. Now, with regards to a dentist, upon enrollment, a dentist is considered a provider type 27. When you enroll, you have to select at least one primary specialty. We have those listed here. And then you can select additional specialties if you need to, but these would be what is available to you in the application. With regards to the PHDHP providers, thanks, Sandy. There is an MA bulletin that is available to you. It is bulletin number 101701, and it provides you information with regards to enrollment in the MA program. So PHDHP providers are licensed dental hygienists who are certified by the Pennsylvania State Department or State Board of Dentistry, and they can render certain services without the direct supervision of a dentist, including, we have some listed there on the slide, cleaning teeth, taking x-rays, polishing fillings, educating patients about their oral health. And upon enrollment in the program, you would be considered a provider type 10, which is a mid-level practitioner, and your specialty code would be 269 for public health dental hygienists. So how to access the enrollment application? If you're wishing to complete a new enrollment, what you would want to do is go to the landing page of the Promise portal. The address is listed there on the slide. You'll select New Application from the Provider Enrollment section of the landing page and then complete the application using the dentist or PHDHP information and then submit. Now this slide here just depicts that landing page and then where you would find that new application link. So each of the online provider enrollment applications assigns a unique, what we call an application tracking number. Once you complete the first page of the application, which is the request information page, you will receive a 10-digit application tracking number. It'll be sent to the email address that you used in completing that very first page of the application. Additionally, that application tracking number will display at the top of the application. And why this is so important is because you will need that application number to resume an application or to check the status of the application. The electronic enrollment system will also send email notices to providers at key points during the application status or application submission and determination process. The emails will be generated from a do not reply email address, and the following emails are the types that you would receive. So upon your initial completion of the first page of the application and you hit save and continue, you will receive an email letting you know that you initiated an application. You'll also receive an email once you actually submit a completed application letting you know your application has been submitted. Now, the online application returned to providers to provider for revision is sent to you if DHS staff does return your application to you for rework during the application process, the approval process. So you would receive an email letting you know your application has been returned to you and you need to go back and resume the application to make the appropriate changes. The online application initiated expiring is sent to you if you started an application, but you did not submit it. We'll let you know that, hey, you never submitted that application and it will be expiring. And then the online application returned to provider expiring, that email is sent to providers if your application was submitted, it was returned to you by DHS staff, and you have not gone back and taken any action on that application, it will expire. This is the request information page, or the very first page of the application. So you can see there are drop-down boxes for you to indicate what program you're going to participate with, whether it's MA or CHIP, what provider type you are, and your enrollment type, whether you're a group or an individual. Of course, we need your tax ID or your social security number, the name, and then the contact information. And this is the email address where those applications would be sent to. Additionally, you'll have to create a password, and then once you click save and continue is when you will receive that very first email letting you know the application has been initiated. And then the next slide will show you the application tracking number that displays on each page of the application. And again, this number will be in that email. It's extremely important that you have that application tracking number, because you will need to use it if you're going to resume an application or check the status. So any questions at all about accessing the application, the ACA requirements, or the application tracking number or emails?
There are no questions in the chat.
Thank you, Michelle. So with that, I will turn it over to Benita Bishop, and she will review the application completion. Thanks, Benita.
Thank you, Lana. Good morning, everyone. My name is Benita Bishop. I'm a supervisor here at Provider Enrollment for PA Medicaid. I would like to go over with you 3 different applications. The first application would be for a new enrollment for the public hygienist. Next, I will go over a new application for individual dentist. And the third application would be for a revalidation of a dental group. And if we can get started, our first page depicts what you would see after you submit an application. As Lana stated, once you go to the landing page of the Promise portal and you select new application, you will automatically start to enter the provider and contact information. Here, as you see, the first is the program type, which is Pennsylvania Medical Assistance, PA-MA. For the public hygienist, you would choose provider type 10 for the mid-level practitioner. This practitioner would be an enrollment type for individual with social security number. And then you would enter the individual's name, last name first name last. Your social security number is required, the 9-digit social security number. And then the next question is asking you, are you a Medicare participating provider? In this case, your answer should be no. Under the provider information, you will list the contact information, and I must stress how important this is. We need the complete and full name of the person you would like us to contact on your behalf, the phone number and email address. When there's an issue with an application, the email address listed here for the contact information is the email address that we use. Whether an application is returned or we have additional questions to ask you, this is one of the ways that we will contact you on behalf of the provider. Next is our service location. Here, this is the location where you are rendering your services. So please complete the street, city, state, the zip code +4, the county, and email again. Also, we must have your phone number for the service location as well. Other addresses. In this section, you have the option to choose the email notification of new bulletins. You answer yes or no. If you choose yes, any new updating information from PA Medicaid you will receive via email. If you state no, please know it would be your responsibility to stay abreast on all new information from PA Medicaid. You also have the option to choose different addresses for your mail to or your pay to. If you choose to have a different address, if not, if you would like to have all correspondence to go to the same as your service location, you would use this check mark here, as you see under the mail to address. You would click that, and all correspondence that is mailed, that will be mailed, will go to the service location address. But you do have the option to choose, especially for pay to, a lot of providers use a PO box for your pay to address. Your specialties. In this case, for your public health dental hygienist, your specialty is 269. That will be your primary specialty. And of course, we've already stated that your provider type is the mid-level practitioner 10. You will also list your license here under the license certificate and permit information. The issuing entity should be from Department of State, and the state, of course, is PA in this case. You will list your complete license number, alpha and numeric, the issuing date and expiration date. Please do not upload any document that has already expired. You should only be uploading current and active information. Next, we have the Provider Eligibility Program, which we consider PEP. In this section, you also have the option to request a backdate. As you see here, the question is asking, is a requested effective date prior to the application submission date? In this case, we said no. But if you have rendered services prior to your application, you submitting your application, you can state yes, request a date, and then you will be required to upload a document explaining why you are requesting a backdate. Okay, and then it will be reviewed. The associated PEP with this provider type is enrolled, not paid. Enrolled, not paid PEP just means that you are actually enrolled in PA Medicaid, and you will not be paid directly by us. You will be paid by your employer. Now, in this section, provider identification, we particularly, this information is used for your 1099 information. So think of this section as wherever you want your 1099 mailed, this is the information that you will put here, the name and address, the contact person who you would like us to contact if there's an issue. For example, we mailed a 1099 and it was returned to us for a wrong address. We would need someone to contact on your behalf. So use this section as your 1099 information. Next, you would enter the provider's birth date and the gender. The title and degree, you can enter it, it's not necessary, but if you choose to, you can. If you are board certified, In this case, the answer is no. Also, you will list your NPI number here and taxonomy. And as you see here, this taxonomy relates to the type of provider that you are enrolling, the public health dental hygiene practitioner. Also in this section, it's asking if you want your Medicare claims to cross over for this location. By answering yes, any recipient who is a Medicare recipient, their claims can cross over to PA Medicaid for payment. The DEA in this case would not pertain to this provider type, so the answer should be no. Additional information. Enrollment languages. If you speak any language other than English, you would list it here. And under your fee assignment, because this is a mid-level practitioner, you should be linked to a group. Your group would be your employer. Here you would say yes. You would enter the employer's provider number and of course the name of the group. Being linked to a group means that, as I stated before, all payments will go directly to the group and then, or your employer, and your employer will pay you. All right, disclosure questions. We call these, have you ever? The next 2 pages, there's a list of all types of possibilities where there might be a violation or privileges suspended or denied, if there are any judgments against you, if there's any criminal history. These questions you would answer yes or no. In this case, if you answer yes, you will be asked to submit documentation as to why there was some type of disciplinary action against you, or a violation or a license suspended. It also asks you a question about a default in a loan. So please be very careful in answering all of these questions. And as I stated before, if you do answer yes, you must upload documentation to explain why you answered yes. Okay, and can we go to the next slide, please? Thank you. So managing employees and ownership. For an individual, in this particular case, a managing employee is not necessary. It is optional. So you can answer no for this question. But if you do answer yes, if you do have a managing employee, you will have to enter the person's name, Social Security number, and their birth date as well. Ownership does not pertain to individuals in this case, so the answer will be no. And then you have the last 2 sections, which is criminal offense and significant business transactions. And then, of course, you would answer that yes or no. And as we get towards the end of the application, any documents that needed to be uploaded, you will see it here as far as the attachments. In this case, the only document based off of your answers was the state provider license. And as you see here, it is the uploaded file name is the actual license number. But anytime that you state yes to a question and it requires an attachment, this is where you will see that uploaded document. And then finally, you have your provider agreement for outpatient providers. Here, this agreement is stating that the provider themselves agree to all federal and state regulations, that they will comply to our policies, If information is requested by them, that they'll have 35 days to submit documentation to us. If there's any type of background information that is needed or fingerprinting that is needed from the individual, that will be submitted, that they will comply. That all federal and state laws you will comply to that as well. Ownership does not pertain to this particular provider type. So ownership does not particularly pertain to this provider type. But the agreement is stating that you agree to all information, that all information is true, accurate, and complete. If you can go to the next slide, please. And then that you understand that you did not make any false statements or omissions. Now, when signing here, this should be the provider's name because the agreement is between Medicaid and the provider and not the person submitting the application on their behalf. Okay. And then that would be the end of the application. You would save and submit. And then you should receive an email stating that the application was submitted. Please know that after submission of the application, that there's a verification period, which could take up to 10 days. So if there's a question or if you realize after you submitted your application and you want it to be returned, we would not be able to return your application until all verification checks have been completed. Okay. Now, I would like to pause here before we move to the next application for any questions.
So Rosemary has her hand up. Rosemary, I'm going to try and unmute you. So hold on. Can you unmute yourself, Rosemary? No. Rosemary, can you put your question in the chat? Unfortunately, I can't unmute you. And then at the end, what we'll have is we'll unmute everybody at that time and have questions and answers.
Okay,
Oh,
just unmuted me. Did you hear me?
Hi, Rosemary, we can now.
Okay. No, I just have a question because I just put in the chat. I have never received any emails with submitting any applications. And you keep saying that you're getting confirmations and all this. Because I do CRNPs, I do dentists and all that, and I never received one email.
So from understanding your question, you mentioned that you entered your email address, but you're not receiving anything in response. You're not receiving any notifications, correct?
Yes.
Okay. Benita, can you respond to that?
When you submitted your application initially, you didn't receive any notifications from us. Did you check your spam?
Yes.
Sometimes it does go to spam.
Yes, I did check our spam. No, I've never gotten anything.
Did you submit an application recently?
Let's see. I did a revalidation recently.
And you didn't receive anything stating that your application was submitted. If I can have your...
I did like 20 people in the past 6 months and I never got anything.
I'm sorry, I didn't hear you.
I got about maybe 20 people done in the past couple months and never received an email once.
That's odd. Well, we can take down your information and speak with you, separately after the training.
Okay, thank you.
Mm-hmm.
There are no other hands up or questions in the chat, Benita.
Okay, thank you. All right, so I would like to move forward to the individual dentist for a new enrollment. And just it's very similar to the individual for the public hygienist. And as we stated before, once you go to the landing page and you select new application, the first thing you will start to enter is the provider information. In this case, we have Pennsylvania Medical Assistance, PAMA. This time the provider type is 27 for the dentist. Enrollment type individual with social security number, and then you will enter the provider's name, last name first, first name last. The social security number, 9-digit social security number, and answer the question if you are participating in Medicare. The contact information, once again, is extremely important. Make sure that we have the complete name, phone number, and email address. The service location, of course, is where you are rendering services. And please enter all information: street, city, state, zip code +4, county, email, and then, of course, the phone number. Our general and historical questions. We have the cost share, Medicare cost share question, asking you questions in reference to your historical location as far as exterior and interior steps leading to the doorway. If you are performing services only as ordering, referring, or prescribing as a provider there. And if you have been screened, if this location has been screened within the last 12 months by Medicare, CHIP, or another state's Medicaid. Our other addresses, as I explained already. In this section, you can request to have your email notifications for new bulletins. And also, if you would like your addresses to be the same as the service location, or you can list a different address for each, the mail to, pay to, or your home office address. In this case, we have the specialty 270 as the primary. The provider type, of course, is the dentist. And you will also list your license from Department of State of PA, the entire license number, alpha and numeric, and you will enter the issuing date and expiration date. Again, please make sure that all information is current and active. Under the PEP section, Provider Eligibility Program, you can request your back date. As I explained before, you can request a date prior to your application submission date. If you do, you just have to upload documentation explaining why. The associated PEP with this dentist is fee-for-service. Fee-for-service will allow you to be paid directly. Instead of your payments going to your employer, PA Medicaid will pay you directly. The IRS legal name and address. Remember, this is your 1099 information. So wherever you want your 1099 to be mailed, this is what you would put here, name and address. The contact person as well, name, phone number, and email address. For the individual dentist, you will enter their birth date, gender, the title and degree if you choose. That is optional. And here we have a new question. Are you board certified? If yes, this will prompt you to upload that document for verification, the issuing date and expiration date of your board certification. Next is your NPI and taxonomy. And if you will want your Medicare claims to cross over for this location, you will answer yes or no. And here we have a DEA. And if you do have a DEA, you will answer yes and list the complete number, alpha and numeric. The additional information with enrollment languages. If you speak anything other than English, you will list it here. And we have an additional question asking you if you have completed the certification for topical fluoride varnish. That is not necessary, but if you have, you will say yes. Of course, you want credit for that. Your fee assignments. As an individual, you do not have to be fee assigned to a group. In this case, they did say no. But if you do fee assign, just remember, if you want to be linked to a group, then you would enter the group's provide ID number and the name, of course. And this also would indicate that your employer will pay you, not Medicaid. That is the difference. And then the next 2 pages are the have you ever questions, asking you if you had any type of violations, if you've been denied, suspended, restricted, revoked, hospital privileges or your licenses, any type of criminal history, you would list this here, or you say yes or no. Just remember, if you say yes to any of these questions, you will be prompted to upload documentation to explain why. The ownership, managing employees. Again, as an individual, you are not required to have a managing employee. So here you can say no. But if you do, then you will be required to list the person's name, their birthday, social security number, their information. Ownership is not required here because it is an individual. And then, of course, you need to answer the criminal offense and significant business transactions. And just to be clear, I'm not sure if I said this earlier, your significant business transactions has to do with subcontracting. So if there is no subcontracting with the provider, you will answer no. Your attachments would be listed here. And in this case, the provider had a DEA, they are board certified, and they have their Department of State license. And as you see here, all 3 documents were uploaded. Okay. And as we get towards the end, we have the provider agreement, just as we did before, just stating that for the next 2 pages, that you agree and will comply to all state and federal laws, policies with provider enrollment and Pennsylvania Medicaid, and that if any information is requested, that you would submit all documentation. If you're required to do any type of testing, such as for background or fingerprinting, that you will comply as well. Now, last page is the submission of details which states that all information is correct and true, that you did not omit or submit any false information. Again, the signature should only be the provider's name and not the person submitting the application on their behalf. Once you complete this, you would save and continue, and then again, you will receive an email stating that the application was submitted. Okay, and then we pause again for any questions.
Yes, there's one question. Addresses for a PHDHP who uses mobile equipment, is one address suffice, such as administrative site?
That is correct. One address is suffice.
And then the second part to that part they had is license number. Only require the PHDHP license, or should we include RDH license and local anesthesia? I do realize the local anesthesia function cannot be used in this setting.
I do believe it is just the PH license. Sandy, do you want to add to that?
That's correct. The only thing we're looking for is the PHDHP.
Okay, thank you.
And you're good to go. That's all I have in the chat. Let me check to make sure nobody has their hand raised. Nope, we're good to go. Thank you.
Okay, great. Thank you. Well, here's the last application. This application is for a dentist group. And this is a established group, so this is a revalidation. And before I move into the application, I wanted just to let you know there is no group for the mid-level practitioner, for the public hygienist, because they are mid-level, so there are no groups for that provider type. But as a dentist, there are groups, there are businesses, and I wanted to review this with you. So as we go to the first page, as we stated before, you go to your landing page, and instead of choosing new enrollment, you would choose revalidation. And for your provider information, the program type is the PAMA, provider type 27 for the dentist, but the enrollment type is group. And then you will list the name of the group. Here we have Smith & Company. Our groups, well, the group will your group must have your tax ID number, and that is the FEIN number, which is listed here. And since this is an established provider already with PA Medicaid, that means they already have a provider number. So we are going to revalidate the provider number that they have had for the last 5 years. Revalidation occurs every 5 years. And the last question here on this slide, are you a Medicare participating provider? In this case, they are, which means they are certified with Medicare. Next, you have your contact and service location information. Once again, I just cannot express how important that contact information is. Please make sure you have the correct name, phone number, and email address. The service location is where services are rendered. So you will have the street, city, and state, your zip +4, county, email, and phone number. The additional questions here are pretty straightforward. Do you bill for a mobile medical unit? Do you bill for a mobile dental unit? The exterior, interior steps leading to the main entrance doorway. If this service location is a rural health clinic or FQHC, which stands for Federal Qualified Health Clinic, and is the service location address being updated to support the 911 addressing system. All straightforward questions, yes or no. Our other addresses, as we've already gone over, you can select your email notification. And if you would like to have a different address other than the service location, if not, you would check same as service location, and all correspondence will go to the same address. Now, for this particular group, they have multiple specialties. You have your primary specialty, 272, but they also render other services. So they have at least 4 specialties for this provider type. The group is requesting the PEP for fee for service. Remembering fee for service means that you will be paid directly. So Medicaid will pay the group or the business directly. And they are not requesting a back date. Provider identification. Remember, this is your 1099 section. So all information pertaining to where you want your 1099 mailed and who would you like us to contact if there's an issue with that 1099, that contact information there as well. Now, because this is a business, you are required to disclose your organizational structure. In this case, this business is a not-for-profit, and they are organized as a corporation. They do not have a DBA, which means doing business as, which means their business name is Smith & Company. Okay? And because this is a corporation, you will be required to upload your corporation documents towards the end of the application. Next, of course, is your MPI and your taxonomy. And as you see, your taxonomy, the taxonomy listed here matches the specialties that the business is requesting to be enrolled. And then that last question, asking, do you want your Medicare claims crossed over for this location? In this case, the answer is yes. Additional information for enrollment languages. They speak Chinese and Spanish. Then we have the topical fluoride varnish question. In this case, the answer is no. Now, remember I stated that the business is a not-for-profit, so they are tax exempt. They have a tax exempt status, so they said yes. And because they said yes, they will be required to upload the tax exempt document. When we ask for a tax exempt document, we are requesting a copy of the federal tax exempt, not state. So a copy of an example of a federal tax exempt document would be a 501c3. Okay. Next is the fee assignment. Now, when you are enrolling a group, when you are enrolling a business, you must have at least one individual who is already enrolled with Medicaid. You cannot enroll a group without having one person fee assigned to the group. So in this case, they do. They have Blake Stevens, and they must list their provider ID number. Okay, so just to recap that, all businesses or all groups who want to enroll must have at least one person who is already enrolled in Medicaid working at their location. Okay. And then the next two slides, as we've already gone over, are the disclosure questions. And the disclosure questions pertain to everyone working at this location, including the managing employee. Any type of criminal record, disciplinary actions, violations, these questions should be answered for everyone for the group. And of course, as I stated before, if you answer yes, you must upload the documentation explaining why you answered yes. So now, as far as the ownership and managing individuals, for a business or a group, you must have a managing employee. Unlike when the first two applications we went over, that is not required. Here, for a group, it is required. You must have at least one person or agent as a managing employee for the group. And as you see here, the answer is yes, and the person's name is listed. You must also list the birth date and the Social Security number along with the address. And then you will state whether if they are an agent or a managing employee. A managing employee is also required to answer if they have any type of criminal offenses related to Medicare or any type of healthcare program. And because this is a business, you must disclose ownership. You must disclose anyone or any individuals or businesses who have at least 5% or more direct or indirect ownership or controlling interest in the group. In this particular case, this business is a not-for-profit. They are tax exempt. Not-for-profit corporations do not have individuals who own the business. They only have board members, but those board members must be disclosed. And this is where you will disclose your board members. Here you will list their name, birth date, and Social Security number along with address. As far as the direct, indirect percent, the number should be 0 because, as I state, board members do not own a business. They just have a controlling interest. Now, if this was not a not-for-profit corporation, and if this was owned by an individual, then you will list the individual here and enter how much they have as far as direct or indirect ownership. When you go to the next slide, you see that this particular business is owned by a corporation. They have answered yes to the question, do any corporate entities have at least 5% direct or indirect ownership interest in the disclosing entity? Since they said yes, they would enter the tax ID number of the corporation who owns the business, the address, and how much percentage that they own. In this case, they own 100% of the business, direct, and 0 indirect of the business. And I know sometimes that this can be a little tricky, and it's very important to know who actually owns the entity. If it is a not-for-profit, most of the time you only have board members. But in this case, a corporation does own this business. So it is listed here as one corporation owning 100% of the business. Our next slide goes into some subcontractors. So if you have any dealings with individuals with ownership or control interest in any type of subcontractors or corporations. This is the section where you will list yes or no. If you list yes, then of course you will have to enter that information just as you did before when we listed the board members and the corporation who owned the business. If you do not do any business with a subcontractor, then as it is here, all answers would be no. Now we have started with revalidations. Now you are allowed to revalidate with one application, 10 locations at one time. In this case, this is what you see here. The group or the business, they have 2 locations and they are doing a revalidation at the same time. We saw the first location at the beginning of this application, and this is the second location. As you can see here, as it says, select to revalidate the provider name, Smith & Company, and the second location here, as it indicates, location 2, where you see the provider number. And then you will enter all the information associated with the service location 2. Here you see the revalidation date. This is the revalidation date for location 2. Once the application has been completed, submitted, and completed, the new revalidation date will have an additional 5 years added to this. So as you see here, the reval date is 6/3/2024. Once the application has been completed and approved, the new revalidation date would be 6/3/2029. And as we get towards the end of the application, you see all of the attachments that were uploaded. Because of the business, you have a copy of the federal tax ID document. You have a copy of the Department of State Corporation document. You also have a copy of the group members form. And the group members form indicates the fee assignment. Remember when I stated if you wanted to have a person linked to the group, because groups must have at least one person fee assigned to be active. This is the person that you will list on your group members form. You will list their name, their provider ID number, their effective date, and then also their signature, the individual signature would be listed on the group members form. And then last, you have proof of your federal tax exemption form. Our last page of this document will be the submission of details. And as we've already stated, this is stating that you understand you had that all your information is complete and correct. There are no false statements or omissions. And in this case, anyone can sign on behalf of the business. Remember, I stated before, only the individual, when we were doing the individual applications, the signature should be that individual. Well, for a business, anyone can sign on their behalf. So in this case, it is the enrollment coordinator. And then you would save and continue, and you would receive your email stating that your application was submitted. And that concludes all 3 applications. I believe there should be some questions in reference to the group, because a lot of times there is some confusion. Is there any questions?
Oh, yes, there is. The first one is, if we are a PHDHP, do we have to link to a group?
The answer is yes. A hygienist, a public hygienist, is a mid-level practitioner. You are not a standalone provider, so you must be linked to a group.
Okay, and then if we are providing services in different school districts, would that still be the same?
You would have to list each service location separately. That would be new application for each service location.
So to correct, each service location would be a separate application, correct?
Correct.
Okay. Let me see if anybody has their hand raised. I do not see any hands raised and nothing additional in the questions.
Okay. Well, thank you for your attention. I'm going to turn it back to Lana.
Thank you, Benita. We're going to pick it up with how to resume or check the enrollment application status. So in order to resume an application, it does allow a provider to resume, the system does allow a provider to resume an application that maybe you started and you've not yet submitted it, or a resume application would be used when one was returned to the provider for corrections from DHS enrollment staff. Excuse me. What you need in order to resume an application is that 10-digit application tracking number. You'll also need the FEIN or the Social Security number of the provider on the application, as well as the password that you created when saving that application. So to resume the application, you want to go to the landing page of the Promise portal. The address is on the slide. You want to select Resume Application from the Provider Enrollment section, and then a link will open and you'll get a window requesting you enter the application tracking number, the tax ID or the Social Security number of the provider, as well as the password. Once supplied and verified, then the provider can resume the application that you've either not yet submitted, or resume the application that was returned to you for corrections. And this next slide just shows that link to resume the application. So once you click that, then this is the screen or window that you will receive, where you'll enter in that application tracking number, the tax ID, or the Social Security number of the person or entity that you're enrolling, as well as the password that you created upon saving the initial application. And then just hit submit after you check the I am not a robot. As far as the application status, that allows a provider to check the status of an existing application that you maybe have submitted, or all complete application. What you'll need to check the application status, again, will be that 10-digit application tracking number, the tax ID or Social Security number of the provider who's on the application, as well as that password that you created when saving the application. In order to check the status of the application, you want to go to the landing page of the Promise portal, select application status from the provider enrollment section, and then a link will open a window which will allow you to enter in that application tracking number, the tax ID or the Social Security number, and the password that you created upon saving the application. And then again, once supplied and verified, The provider can view the status of the application, whether it was submitted or not, and you can also view the application and make a printed copy if you didn't of the PDF file of the application that you submitted from this page. So again, in order to check the status, simply go to the landing page of the Promise portal. In the providers section, select application status. A window will then display, which will allow you to enter in your application tracking number, tax ID, or social security number of the provider that you're enrolling or entity, and then the password that you created. You'll notice on the bottom half or the half of the screen, there is that link that allows you to click on the PDF version of the application, and you can print it if you hadn't printed it previously. Now, with regards to, first of all, are there any questions before I move on with regards to resuming an application or checking the status?
Now, we have a couple follow-up questions for Benita, but I'll bring them up once we're done with change requests. Thank you.
Thanks, Michelle. Okay, so change requests. Thanks. So change requests allow the provider to change specific enrollment information through the enrollment portal. And the things that you can use a change request for would be to update group member information. You can use a change request to close an existing service location or to make changes to your mail to, pay to, or home office address for an existing service location. You can also change an IRS address for an existing provider. You can use a change request to change an email address for an existing service location, or to terminate association or fee assignment with a provider group. An individual provider can do that, or to add or terminate a specialty code for an existing service location. A change request is the fastest way to have these tasks completed. So we encourage you to use the change requests if you're going to be needing to perform any of these functions. And how to submit a change request is you're going to go to the landing page of the Promise portal, and you're going to need to log on to the Promise portal. Once you log on, you'll page and you'll select change request from the provider services section on the My Home page. And this is the My Home page, and you'll see the link there to submit a change request. So again, the fastest way to get those changes or tasks completed would be to submit a change request. So any questions on the change requests?
Not that I see right now.
Okay, so we'll move on to our resources that are available to providers. So first we have the link there to the Promise portal where you can access the electronic provider enrollment application. If you require additional information about provider enrollment, there is the link there, which will take you to the DHS website, and that is information regarding your provider types and what's required for them. We also have the link there for the provider enrollment and screening requirements of the Affordable Care Act, and this does include the most current information from the department relating to ACA federal mandate regulations. We also have the link which provides information about ACA federal mandated regulations and how they relate to the Medicaid program. Moving on, we have the phone number for the provider enrollment unit, the 800-537-8862. Press option 2 and then option 4 to speak to an enrollment representative. There's also the link to the DHS website, and on the website is where you'll find the MA regulations, you'll find provider handbooks, billing guides. The fee schedule is also out there for you. As far as provider quick tips are concerned, I do have the link to quick tip number 265, which provides you information on how to check the status of your submitted electronic enrollment application and actions to take if your application has been returned to you for additional information. And then there's also the link to the medical assistance bulletins. Remember, we reviewed, or we talked about bulletin 102701 for the public health dental hygiene practitioner enrollment in the MA program, if you wanted to take a look at that. And also there's a link for the revalidation of medical assistance providers. Additionally, I did not put this on the slide. My apologies, but we do have provider training, which is available to providers if you need assistance with setting up your Promise Portal account, if you need assistance with maybe learning how to check eligibility or submit claims on the portal, or just navigation of the portal if that's what you're going to use to bill. You can certainly email us and request a one-on-one provider training where we take you into a virtual room and review all that information, as well as answer your questions. And that can be, you can email us if you're interested in that at promise.providertraining@gainwelltechnologies, all one word, .com. So again, if you're interested in training, it is promise.providertraining@gainwelltechnologies.com. Thank you. So we'll now open it up for questions.
So there's 2 questions in the chat. The first one is, what is the expected time frame from enrolling to approval for each application? For clean applications, the team is processing them within 30 working days. The second question is a clarification question asking about the school hygienist. Donna, I'm going to take you off mute because I'm not understanding what you rewrote in the question. So let me find you in here and take you off, or if you can unmute yourself as well.
Okay, yes, good morning. Yeah, I'm sorry, I am just confused because I had put a question in the chat box about if a PhDHP is working with mobile equipment, do we have to list every single location, or will the administrative center work? And the answer was the one address, like an administrative office center. And then somebody else questioned, I believe as a school dental hygienist, PhDHP, asking whether they need to list every individual school, and the answer was yes. So I am.
So let me ask the question. Yeah. Are you mobilely setting up so you have a vehicle that pulls up and the kids come in, or you bring equipment into the school and take it out at the end of the day, or do you have an actual room set up at all times for dental work at the school?
No, I have mobile equipment, and I go school to school.
Right. So in that case, your brick and mortar administrative building would be the location you enroll in, and you would be a mobile dental unit.
Okay.
If you're set up an office in each school, then those schools would all be service locations.
Hmm.
So that's the difference.
Okay. All right. Thank you.
Mhm.
There's nothing in the chat. I'm just seeing if there's any hands raised. I don't see any. If you have any questions, please come off mute. We're here to help you.
Also, you can have my email address. I think my email address was originally given when the link went out, but it is Benita Bishop, BEBISHOP @pa.gov. And you can email me directly. You might have a question later. And then I think, what's that, Miss Rosemary? You had an issue with your email. You can email me directly and I can help you.
I am not seeing any more questions or hands raised. Sandy, would you like to take over for closing remarks?
Sure. I just want to thank you all for participating today. We will, like I said at the beginning, be posting this PowerPoint, the recording, and then questions that you were asking and our answers will also get posted. We are currently transitioning the DHS website, so as soon as possible, we will get this posted. I just don't know exactly how long that's going to take. In the meantime, if you have any questions, please feel free to contact Benita or call our helpline at 800-537-8862, option 2 and option 4. Hope you have a great day. Thank you.